Hey, what's up everyone? I'm Chris, and we're going to cover the CPR and AED skill sheet. Let's get to it. All right, so when we're talking about the CPR and AED skill sheet for your EMT class, if you've done a CPR class, it's more or less the same sheet. So this should be a pretty simple thing for you if you've already done your BLS checkoff. But either way, let's run through it so that you can feel confident when you go to test off in your class. So as with everything, the first thing we're going to do when we're doing the skill is we're going to verbalize our PPE, do our little jazz hands, BSI, PPE, all of that, and make sure that your proctor knows that you've got that going on. And from there, we're going to make sure our scene is safe. So our normal BSI, PPE is my scene safe. You'll be told your scene is safe. For our students, we give some little basic scenario. You're dispatched to a local coffee shop for a report of a man down, something simple like that, just to kind of set the stage for you. So you'll arrive on scene, you'll have your patient here, and the first thing we're going to do is check responsiveness. So we'll do that quick AVPU check. Alert, hey sir, they're not looking at me, so they're not alert. We'll move down to the verbal, sir, do you hear me? No response to verbal stimuli. Move to the P, we'll do a little trap pinch, something like that. And then again, no response. As we already know, but we want to go through the little song and dance here. And so we're going to determine that this patient is unresponsive. Because I have an unresponsive patient, I need to next go and check for pulse and breathing. We want to do that simultaneously for at least 5 seconds, but no more than 10 seconds. If you're going more than 10 seconds and you're not feeling a pulse, the likelihood that they have a pulse is pretty low. So we'll just move into CPR. But we want to give at least 5 seconds to find that pulse site. In case they have a slow heart rate, we want to give ourselves time. So we'll come down here. We're going to check at the carotid artery. It's a silly thing, but we always teach to check the carotid artery on your side, because if I'm checking over here, it could look like I'm choking the patient, and that's just not a good look for us. So we'll check on our side. Get down here. We want our face and our ear close to the patient's face for 2 reasons. Number 1, that way I can listen and feel for their breath on my face and in my ear, and I can visualize the chest to look for that chest rise and fall. So check the carotid. I'm going to come down here. I'm going to look, listen, and feel for at least 5, no more than 10 seconds. And your proctor should tell you the patient is apneic and pulseless. So at this point, we know that we need to do CPR. So we're going to ask for ALS assistance, and we're also going to ask for an AED. The way that I proctor when I'm doing this, and you might have a proctor that will do the similar thing, if you forget those steps and start CPR, I'm going to watch you do CPR until you remember. And to be honest with you, I'm probably internally laughing as you're continuing to do CPR and getting tired out because you forgot that step. So make sure you're remembering that. And as you're going through this process, if you feel like you've been doing CPR for a long time and nothing's happened, kind of reevaluate, and you might have forgotten to ask for that AED. Okay, so check for pulse breathing. You'll be told no pulse or breathing. So we're going to come down and we're going to ask for that AED and ask for ALS assistance. At this point, we can begin CPR on our patient. If the patient has a shirt, we're going to remove that shirt, and then we're going to start to do some CPR. So when we're doing our CPR, we want to place our hands right about the nipple line, or where the nipple line should be. As patients age, that nipple line might slide down. So we want about where that nipple line is going to be, and right on the sternum. Okay, so we want to make sure to stay off of the xiphoid process. We don't want to break that xiphoid process off and have that little piece of bone essentially free floating there that can cause some significant damage internally. So we'll be right on that sternum, and we want to be right on the palm of our the heel of our palm here. Okay. This is going to be a little bit hard for me. We have this table a little higher than I'd like for demonstration purposes. I'll do my best. I'm not very tall. But you want to put that here, and then you want to lock your arms out. You can do fingers interlaced. You can do hands crossed. I don't care. Nobody at IMA really cares about how that goes. Really, that bottom hand is going to be your real driving force. And so we want that to be perpendicular to the patient's body, right over the sternum. And then we'll get our other hands. I don't like to lace just because I have kind of thicker fingers with bigger knuckles and it gets uncomfortable after a minute. So I like to just lay my hands on top, and then you're going to get your body over their body. We want to keep our hips and our body close to the patient's body as much as we can. The further away we are, the less power we have. So we want to be nice and close so that we're in a powerful position for doing chest compressions. We also want to have our arms kind of straight and locked, and we want to stack our body. So I like to think of my shoulders directly over the patient's sternum. If I'm sitting back on my heels, I'm giving high fives to the chest. I'm not pushing with my whole body. So we want to put our hands here. We want to be lean, nice, and over, and we want our chest directly over their chest. That way we can use our entire body weight to force for those chest compressions, okay? And again, it's not gonna look really good here. We'll do some other shots so you can see it. So we're gonna come here, do our CPR, okay? And we're gonna do a CPR at a rate of 100 to 120 per minute. So if you wanna remember Staying Alive, Baby Shark, Living on a Prayer is another one. Don't do it like Michael Scott in The Office, right? We're gonna do it at the main portion of the song. We're looking at that 100 to 120 beats per minute. And a couple things we need to really be thinking about as we're doing compressions. Number one is going to be our compression depth. So dependent on the size of the patient, there's different numbers there. But for the most part, we're looking for about 1/3 to 1/2 the depth of the chest. And that goes between adults and children, all different age groups, 1/3 to 1/2 the depth of a chest. So in general, you're probably going to want to be pushing harder and deeper than you think, especially when you're new to this and you're starting to get the feel of it, and especially on a real patient. So on a mannequin, hopefully you'll have some good feedback, whether that be this one has lights in the shoulder. You may have a nice click at the chest when you're doing correct depth compressions. You may have a different mannequin that goes to some sort of tablet or TV screen so you can see your depth. Just try to get some feedback if possible and make sure that you're hitting that depth. So depth is really important. And then we also need to consider our recoil. So I like to use a BVM as an example of the heart. And so what we're doing is we're pushing down on the heart to eject blood from the heart. And we're pushing down, okay? So as you see, every time we come off, this bag will fill again. And that's the same as the heart filling with blood. If I'm only letting go here, and not allowing that full recoil, I'm not allowing that heart to fully refill with blood. So every compression I'm doing is inadequate because I'm not pushing that blood throughout the body, okay? So we need to think about our depth and then also about our recoil. We're not a pogo stick. We're not coming off of the chest every time, but we're gonna push and we're gonna allow the chest to fully recoil. All the way off. We can take our weight off. We can stay in contact with the chest, but let it fully recoil up, okay? So we're gonna continue to do that at a rate of 100 to 120 a minute. And we're gonna be doing a rate of 30 to 2 compressions to ventilations. You might not see that in the field, and maybe where you're at, you're gonna learn something different. There are places that are going more to asynchronous CPR where the chest compressions are done consistently. With breathing done at intervals without stopping chest compressions for National Registry standards. So if you're in your EMT class, National Registry standards state that we're still doing 30 to 2 compressions to ventilation ratio. So 30 compressions, and then we're going to come over here and we're going to breathe 2 times. For our class, we're not too worried about the breaths. It's more about having that timing thing of the 30 to 2. We teach BVM as a separate skill, so when you see it here, it's really de-emphasized in our CPR skill sheet because that's a skill you learn otherwise differently. We do a BVM. You may have a pocket mask or something like that that you're going to use as well. Either way, we're going to be doing 30 to 2 compressions to ventilations ratio. So when we are doing our ventilations in CPR, we all know that good practice for ventilations when we are bagging a patient is 1 breath every 5 to 6 seconds, right? Hopefully you know that at this point. If you didn't, that's how we're going to do it for our airway station is 1 breath, count to 5, and then we're going to give another breath. That's not what we want to see in CPR. We're going to give breath, okay? Maybe a second pause in between those 2 breaths. One of the most important things we need to concentrate on during our CPR is going to be the CCF, or chest compression fraction. And that is how much time during this whole process we are spending on the chest compressing. And the higher the better. We want as much time on the chest compressing as possible because that is circulating blood. All the time that I bring my hands off the chest to do anything else, there's no blood being sent to the brain, to the heart, to the liver, to the kidneys, to any of the perfusing organs that we need to be sending blood to. So we want to be considering that chest compression fraction, and we want to keep that up nice and high, okay? So that means when we're breathing, we'll get off the chest quickly, but remember, slow is smooth and smooth is fast. So come over here, nice and smooth, put your mask on, give a breath, and right back to the chest, okay? So we'll be doing that. We'll be doing our compressions. I want to hear counting, especially as we come up to 30. So we'll say I'm at 25, 26, 27, 28, 29, 30. Come over. We're going to do breath, and then right back on the chest, okay? So for your testing scenario, for your testing station, we're going to let you go for a little while because we need to verify that you're doing this correctly. So pretty common for us to let you go about 2 minutes or so. Around a CPR is going to be 2 minutes, so we'll probably let you go for about 2 minutes just to make sure that you're doing that correctly, okay? At that point, so long as you've called for the AED, your partner should bring in the AED. We might have a partner there for you. You might have your proctor just hand you the AED, but at that point, the AED is going to arrive on scene, and that becomes your job on scene, okay? Your partner is there for compressions. What we don't want to see is you just stop and come over here and grab it, and there be no coordination between you and your partner, okay? So as we're doing it, we want to come in, we want to communicate with our partner, right? So I'm here, I'm going to tell my partner, all right, you take over in 3, 2, 1, go. And they should already be hands here waiting and jump right on, so there's very minimal interruptions. That's really important, is that minimal interruption when we're doing CPR. So they're going to take over for me. They'll continue to do compressions. I want to keep an eye on, make sure they're doing everything okay. They're not going super fast, super slow, anything like that, but this is now my job to take care of the AED. So we'll open up our AED, and we will grab out the AED and the pads. Training AEDs sometimes have some little specific intricacies with the training AEDs as far as the process of things. So just keep that in mind. Make sure you know your AED and how it works. This is what we carry at IMA for our students. You might have something a little bit different. So the first thing that we're going to do is turn the AED on, and then we will follow the prompts. Just for the sake of the video right now, I'm not going to turn it on because it's loud and it would talk over me. But I'll talk about what the AED will be saying. So I'm going to turn the AED on, and then it's going to tell me to plug in the pads. For these AEDs specifically, if you're one of our students, we want to see you place the pads on the patient first. The reason being, a real AED is looking for impedance against the body, okay? And so it won't start cycling until it recognizes that resistance from a patient's body. This is all plastic, a trainer, so it doesn't have that. So how this AED is going to be triggered to start the cycle is once we plug in the pads. So if I plug in the pads first without putting the pads on, it's going to start to tell me to do all the AED things. And so we want to see you turn this on, and then you're going to put the pads on and plug it in last, okay? Just make sure you plug it in last. When we're looking at the pads, there's going to be some pictures on the pads of where these pads go. Make sure you follow the pictures. If you do it incorrectly, you're going to fail the station. So just look at the pictures and place them exactly where they're supposed to be placed. When we're placing these, the compressor is not going to stop for you, okay? You need to work around the compressor's hands, maybe work around their body to get these on there. So they're going to continue to compress and just do the best you can. If you just, for whatever reason, maybe they have gigantic hands and you can't put the upper chest one on, at least wait until they're going to do their breaths. And then when they're off the chest giving the breaths, then place those on, okay? So I'm going to take a look at my pictures here. I'm going to place, one's going to go on the lower left and one's going to go on the upper right chest. Make sure those are secured. And then we can plug it in. All right, so once we're plugged in, the AED is going to tell us it is analyzing and to get off of the chest, okay? When the AED is analyzing, it's looking at the patient's cardiac rhythm to see if the patient is in VTAC or VFib or something different. If it's in VTAC or VFib, it's going to tell us to shock. If the patient is in anything else, it's going to say no shock advised. But it needs to have our hands off so we're not affecting the reading. So hands off at this point, it's going to do its cycle, okay? And then it will give you the prompt of either shock advised, charging, or no shock advised, continued CPR. Follow the AED prompts, whatever it tells you to do. So it's really easy. If it tells you no shock advised, back on the chest, and we're going to continue to compress. And in 2 minutes, the AED is going to restart its cycle, and we'll follow it at that point. If it tells us shock advised charging, you can go one of two ways. You don't need to do compressions at this point per the AHA requirements, but we're better than the AHA requirements. We're professional EMS responders, and we need to be better than that. So what we want to see as it's charging, we want to see compressions being done, okay? Once it's viewed the chest to know what's going on or viewed the heart rhythm, it's not looking at it anymore. We can do compressions while it takes the 3 to 5 seconds, however long it takes to charge. So it's going to say shock advised charging. I want to see compressions again. This one in particular is going to tell you to stay clear of the patient. I want you guys to ignore that if you're one of our students, okay? We can continue to do compressions, and then once it's fully charged, it will start to give a tone, and the shock button will start to flash orange, okay? So shock button right here, that will start to flash orange. As it does so, now is our time to stop compressions again. So my partner's doing compressions, I see it flashing. I'm going to visually make eye contact with my partner and say, clear the patient. You're clear, I'm clear, everybody's clear. You'll hear a million different ways that people like to do this. Make sure that everybody is clear of the patient. Visually check the patient, make sure everybody's good. And don't just look for their hands in real life. This isn't going to shock you. This isn't a big deal. In real life, though, we need to make sure that nobody's touching with their legs. Nobody has a stethoscope around their neck that's touching the patient. Make sure the patient isn't in a hospital bed touching a metal railing with your partner touching with their hips, anything like that. So make sure everybody's all clear. Once everybody's all clear, we'll hit the shock button and immediately back to compressions, okay? It's going to tell you to continue compressions. It's going to take a couple seconds. Try to be faster than that and immediately get back on compressions, okay? So once you've done that, your partner will be compressing again. And this will have the metronome. You can follow the metronome. That's usually set to about 110 or 112 beats per minute for the metronome for your chest compressions. And for our skill sheet, that's it. Once you've delivered that shock, we want to see you get back on those compressions without having that long pause, and you're good to go from that point, okay? One of the critical fails that you'll see on our sheets is going to be interruption of more than 10 seconds during CPR. Obviously, that doesn't count for the AED. The AED, and this thing feels so slow, especially when you're in a testing scenario. It feels really slow, but that interruption is just required. What we don't want to see is after you hit the shock button, it takes 15 seconds for somebody to start compressing again. Okay, so that's one of those things you need to make sure that you're looking out for. But as long as you've done all of that, then you have successfully passed the scenario. So from here for this video, let's go take a look at a testing scenario so you guys can see that.
You've been called to a scene at a coffee shop. 70-year-old male is down and unresponsive.
Okay, BSI, PPE?
Yes.
All good? Okay, so I'm gonna approach my patient, determine the level of responsiveness. Is he tracking me as I walk up or looking at me at all?
No.
No? Sir, any response to verbal?
No.
No? Painful, we'll do the trap pinch. Any response?
No response to pain.
No response? Okay, so let's go ahead and check pulse and breathing. I'm gonna be checking the pulse here at the carotid. I'm gonna look, listen, and feel for breathing. I'll be checking for at least 5, but no more than 10 seconds. Do I have anything?
The patient is unresponsive to apneic and pulseless.
Okay, so I will call for ALS assistance, and I will ask my partner to go grab an AED while I start compressions. Make sure the chest is clear. I'll be doing 30 to 2 at a rate of 100 to 120 a minute. 27, 28, 29, 30. 1, 2. Five, 6, 27, 28, 29, 30.
I have the AED. I'll take over compressions. You operate the AED.
All right, you're all ready for chest compressions?
Yes.
So you'll do 30 to 2 while I get this ready. I'm going to open this up and turn on power. Because it's training AED, I will do the pads
Apply
first.
pads to patient's bare chest.
Check the pictures. Work around your hands, perfect.
Apply pads to patient's bare chest.
Pads are on, I'll plug it in.
Do not touch
Go
the
ahead and
patient.
clear the patient.
Analyzing heart rhythm.
Hover for me, please, while it analyzes.
Do not touch the patient. Analyzing heart rhythm. Shock advised.
All right, go ahead and on the
Charging.
chest, please.
Stay clear of patient.
Keep going, keep going.
Deliver shock now.
All right,
Press
everybody
the
clear?
orange button
Everyone's
now.
clear. Shock, back
Shock
on the chest, please.
Delivered. It is safe to touch the
5, 6,
patient.
8, 9, 10, 11,
Begin
12, 13,
CPR.
14.
All right, everybody. That was our CPR AED skill sheet. Hopefully that gave you some good insight about what to expect when you come in for your skills, whether that be with us or with a different program. Or maybe it's just a good refresher for you. So make sure you guys are really learning that skill sheet, learn those steps. Even if you're not there with the equipment in front of you, you can still understand the steps and what you need to do to be best prepared for when you go and check off the skill sheet. Make sure to check out our YouTube. We got all the other skills out there. We got some other good stuff out there for you. And we will see you guys on the next one. Thanks.